ADHD Awareness Month. And joining us this morning from Gundersen Health System is Dr. Harvey Weinberg. Thanks so much for joining us.
Thank you.
So first of all, let's go in depth a little bit more about what exactly is ADHD.
Well, as you indicated, it is a neurobehavioral disorder. It's a disorder of behavior. These youngsters are very intense, very active. They need to be on the go. They have wide-ranging energy. In addition, they tend to be impulsive, reckless, thrill-seeking. And you place these kids in a classroom environment, what happens is that they have a lot of difficulty focusing on learning activities, and they can be disruptive. They rather talk to their friends than sit down and do their schoolwork. As a result, they have a lot of generalized difficulties, not only functioning in the classroom, but also functioning at home with their friends, socially and emotionally.
And when you speak about high energy, go, go, go all the time, when kids, a lot of the times, most kids are like that. So how do you decipher between what is just a kid liking to have a lot of fun and actually an ADHD diagnosis?
Well, actually, that's an excellent question. Because a lot of practitioners, a lot of parents are a little befuddled by that. And really the distinction you need to make is that if you see a child in a group situation, whether it be a birthday party, at the library, or in the classroom, yes, kids can be very active, but they stand out in the crowd. They really look different. So you can have a bunch of young guys playing t-ball at the park. They're gathered around the coach, but there's a one or two running around the field trying to catch butterflies. So the distinction is relative to their age group. They must stand out in the crowd as being different.
And treatment, I'm sure, has been advancing through the years. How is it now these days?
Well, there's three fundamental components of treatment. First is medications. There's a wide range of medications that can be used to have a calming, quieting effect, but most importantly, allowing them to focus. But medication does not take care of each and every problem. It's much, much more complicated. So the other elements include what we call psychosocial interventions. That might consist of counseling for the parents, for the youngster, parents learning and educating themselves about ADHD. And the third main component is what happens at school in the classroom environment. So teachers are charged with helping this youngster do their very, very best to ensure that they are successful in the classroom and other aspects of education.
Thank you so much for all that information, Dr. Weinberg. We are out of time. One last thing, though. Is this a lifelong diagnosis, or is this sometimes just a different stage of life for people?
Well, it's a developmental problem that can follow many individuals throughout life. As you get older, what we discover is that some of these problems will soften and go away. But for some, even into adulthood, there can be remaining difficulties, and they are going to be challenged in different areas of their life functioning.
Well, thank you so much for all that information this morning.